Welcome to Essentials of Acute Care. I am Dr. Sunil Garg. In part 1 of our series on initiating invasive mechanical ventilation in adult patients in ICU, we discussed about indication and objectives of mechanical ventilation. Today in part 2, I am going to discuss how to make initial mode selection. It is important to understand that there is no universal mode which is suitable for all adult patients in intensive care unit. Hence, regardless of initial mode selected, it is not uncommon to change the mode if patient demonstrates any intolerance or dyssynchrony to the selected mode. Common initial modes include volume or pressure limited assist control mode and synchronized intermittent mandatory ventilation with pressure support. So, what are the differences between various modes? The modes of mechanical ventilation are distinguished from each other by the type of breath that they deliver. The delivery of breath is typically either volume limited or pressure limited. Here you can see details of various modes used in intensive care unit. Irrespective of different modes, breath is either volume limited or pressure limited. In most commonly used assist control mode, breaths are both ventilator and patient triggered. Regarding termination of breath cycles means where inspiration ends and expiration begin. In volume limited breath, it is decided by the volume. In pressure limited breath, it is decided by the time, and in support mode, it is decided by the flow. What is volume limited breath? Volume limited breath can be ventilatory initiated or patient initiated. It delivers a predetermined tidal volume at a rate which you have fixed on ventilator, so it ensures a minimal guaranteed ventilation. Tidal volume is delivered at a flow rate which you have set on the ventilator, and inspiration is terminated once that tidal volume has been delivered. Airway pressure on the volume limited breath is determined by the resistance and compliance of the respiratory system. The common modes which deliver volume limited breath are volume limited assist control and volume limited SIMV modes. Here you can see a screenshot of volume limited assist control mode. These are the parameters which has to be set in order for ventilator to deliver breath according to set parameters, and here you can see respiratory rate, tidal volume, flow rate, flow pattern, oxygen concentration, and the PEEP. These are the parameters which are derived and reflect patient's parameter, and here you can see peak pressure, plateau pressure, PEEP, I ratio, total respiratory rate, expired tidal volume, and the mint ventilation. What is pressure limited breath? Pressure limited breath can be ventilator or patient initiated, and it delivers a predetermined pressure at a rate which you have fixed on ventilator. So flow of air into the lungs is determined by the set pressure limit. Inspiration is terminated once set inspiratory time has elapsed. In this type of breath, tidal volume is variable and it is related to the compliance of the respiratory system and the resistance of the airway and the tube resistance. The consequence of the variable tidal volume is that a specific mint ventilation cannot be guaranteed in this type of breath. The common modes which deliver pressure limited breath are pressure limited assist control mode and pressure limited SIMV mode. Here you can see a screenshot of pressure limited assist control mode. These are the parameters which has to be set in order for ventilator to deliver breath according to the set parameters. And here you can see respiratory rate, set pressure limit, inspiratory time, oxygen concentration, and the value of PEEP. Here are the parameters which are derived and reflects patient's parameter. Here you can see peak pressure, I ratio, inspired tidal volume, expired tidal volume, mint ventilation, and the plateau pressure. Remember, in this type of breath, specific mint vent volume cannot be guaranteed. Another commonly used mode of mechanical ventilation in adult patient in ICU is pressure support mode. In pressure support mode, all breaths are spontaneous, means all breaths are patient triggered, and triggered breaths are supported by ventilator. The ventilator provides the driving pressure for inspiration, and the level of this pressure determines the maximal airflow rate. Inspiration is terminated once the inspiratory flow decreases to a predetermined percentage of its maximal value. Here you can see a screenshot of pressure support board. Here pressure support value of 5 has been fixed and this is the driving pressure of flow for each breath. In addition to oxygen concentration and the value of PEEP, here you can see an additional parameter and that is E-sense. This parameter determines when breath should be terminated. Here the value is set at 25. It means when the flow will reach the 25% of its maximal value, breath will be terminated. Now we will discuss factors which influences or determine the selection of initial mode. Primarily, mode of selection is decided by very basic reason of placing patient on mechanical ventilation and the severity of underlying illness. For example, patients who are mechanically ventilated for respiratory failure need more support than those ventilated for airway protection. In general, assist control mode, whether volume or pressure limited, is appropriate for most situations. As discussed, indication of mechanical ventilation is an important criteria for selecting the mode. For example, patients with the acute respiratory distress syndrome are typically placed on low tidal volume ventilation delivered using the assist control mode. In contrast, a patient who is mechanically ventilated short-term for the airway protection may be suitable for the several additional modes including SIMV with pressure support or pressure support alone. If there is presence of airflow limitation in a patient, like in the presence of chronic obstructive lung disease or acute asthma or acute COPD exacerbations, volume limited modes of ventilation are commonly used. In contrast, pressure support or pressure limited modes including APRV are generally avoided in such patients. While in the presence of air leak, like in patients with the pneumothorax or lung surgery, pressure limited ventilation or SIMV with pressure support or even pressure support alone are preferred in order to limit additional barotrauma and worsening of the air leak. There is another area of concern are those patients with the elevated intracranial pressure and what are the evidences which support one mode over other. While volume limited modes are frequently used in patients with the elevated ICP, pressure limited modes are popular due to the theoretical concern that elevated intrathoracic pressure hamper venous return and therefore worsen intracranial pressure. However, there are no data in this population to suggest that one mode is superior to other. For patients, those who are heavily sedated or paralyzed, pressure support ventilation is contraindicated and assist control modes are typically used. Another factor which influences the choice of the initial mode is clinician familiarity and the institutional preference. Thanks for watching this video. If you like this video, please subscribe to it. Once again, thanks and see you again in another video.